The Nashotah program is a residential program using dialectical behavior therapy. It's an all-adolescent unit for females who are of high school age. Typically, the average patient is someone who has difficulties with emotion regulation, which can lead to other behaviors like self-injury or suicide attempts or chronically thinking of suicide. Often, unbeknownst to families, that this pattern has been going on internally for much longer than people are aware. But typically they've been suffering with pretty severe symptoms of depression, struggling with shame, and behaviors that are ineffective for well over a year. And they seem to be stuck in a cycle where they may be hospitalized or have sought other treatment but don't seem to be getting better or easily relapse into dangerous behaviors. The most empirically validated treatment is going to be dialectical behavior therapy. We do a lot of self-reports each week throughout their treatment. So we have a lot of scales and measures that we take when they're admitted and also when they're discharged, several of which we're doing every week along the way. Some of the measures we're looking at are mindfulness, also their difficulties with regulating emotion, also how much they're suffering interpersonally, and a depression rating scale. Those are helpful in a way that we can kind of see if they're struggling at all in any particular area, what we can beef up and try to help improve for them along the way. We're also at the same time, watching in the milieu, so seeing how they're interacting with each other on the unit. That becomes a good indicator. You also get a feel when someone's becoming healthier. It really feels like almost like a cloud is lifting, like it starts feeling like you're with a person in the room. Residents start seeming like they're more in their body and more present and less anxious behaviors while they're sitting with them. What we're seeing is that the effectiveness of treatment is effective while they're here, and that the effectiveness scores are actually higher a year out from now, which to me suggests that actually they're continuing in the recovery. They're not being readmitted after being in the program, and to me that's probably the most important thing, is they're not falling back into the kind of ineffective behaviors that were dangerous as before. It's a very intense program, that's why it takes so long, but the change is very deep and takes a long time and a lot of willingness on a resident's behalf. And I think it's worth it, because I think it's preventing you another decade of suffering. And we know that when families are ready for change, residents are ready for change, we hit the ground running. We do some pretty amazing things. And I think that some of the residents have launched into life really well from this, where when they came in, they didn't have any hope that things could be different or that they'd ever want to live again.